Hey guys, this is a little short video on ports. Port is a type of uh, surgery and insert that helps if you're going to be getting chemo. Chemo can't always be given in your arm because many chemos are called vesicants, and that means they can burn the smaller veins in your arm. So they need to be infused into a larger vein that goes, a bigger vein, like going into your heart or away from your heart, uh, depending on where they place it. Most of the time, I think it's leading into your heart to be pumped out around your body, but obviously that is really determined by the surgeon and the chemo oncologist doctors. As in that level of detail, you need to consult the doctor. But in general, it is meant to be placed in a larger arterial vein that can handle the toxicity and spread it so it doesn't burn the the vein size. All right. The other thing I want to talk about is picking your doctor. Make sure you pick a surgeon that you really believe in, that has a attention to detail, that has a good reputation amongst other doctors outside of the surgery field, and make sure that when you talk to them, you believe that they have quality first and not commerce. Some doctors get in a hurry and they have tons of patients, and commerce comes before quality or care. You don't want to pick a doctor like that because ports are very serious things. They can be very useful and helpful, but when a port is placed, it can be placed wrong. And there's an x-ray taken after the surgery to make sure it's properly placed. If it's not properly placed, then they can't use it to infuse the chemo. So that's a big deal. And my sister, when she had her port placed, it wasn't placed properly, and the nurse was trying to infuse the drug into the arm because she didn't want to get behind on the schedule, but it was a vesicant and it couldn't be infused in her arm, so the order had to be held and her chemo had to be delayed until they could fix the port. I was very fortunate. My doctor did a great job. My port was placed properly and I didn't develop an infection. I've heard of other people that have developed infection with the port, and that delayed their chemo. So that's another complication. There's probably other complications that could happen, but those are the two that seem common I've heard of. What I did to prepare for the surgery is I took Dial antibacterial soap and I washed the area the night before the surgery, and then I got up early and washed it again. Everywhere in the area with Dial's antibacterial soap. I couldn't find any Hibiclens, but there was the Dial, so I used that. And the doctors do their own cleaning and prep, but I was trying to help out, and I had heard of that from other people, so that's something you could do to help out. The doctors are still going to do their own sterilization process, but it can't hurt for us to do multiple, attempts right immediately before making sure the skin's dry and everything when you get to the hospital. The other thing about ports and picking the right doctor is the way that they cut you, because this is going to leave a scar, and the bigger the situation, in this situation they have to do 2 incisions to place the thing properly, but that's a band-aid, by the way. That's not my skin. But my doctor did an excellent job of not making a huge gash in my neck and my chest area and leaving a big old honking scar. My sister had kind of an emergency biopsy, and we'll talk about biopsies in a minute, but she had been she'd been going to a doctor, and for 6 months he couldn't find out what was wrong with her, so she went for a second opinion, and the doctor diagnosed her in 24 hours with Hodgkin's lymphoma, and he had her lymph node taken out, but because it had been 6 months going to a doctor that was not, I guess, qualified to realize what he was dealing with, this second doctor was in a hurry because, my sister had been sick for a while. And so he just got the first surgeon and the fastest biopsy lymph node. It was a lymph node because she had Hodgkin's lymphoma, and they removed the entire lymph node to, test it. And they did a good job because they were in a hurry and there was no hard feelings, but it left a huge scar on my sister's neck. So if you have the time, try to make sure you pick a doctor that is going to have really good technique and skills to minimize any kind of impact to your, when possible. If it means your life, then what's a scar, right? But that's just something to think about. So ports, it was very sensitive. I was originally got my port on Wednesday to start chemo on Friday, but the insurance delayed it. I wasn't happy about that from a cancer treatment perspective, but I got to thinking about it, and it was nice to have a little time for the port to heal because it was serious surgery, and it was very vulnerable and it hurt and it was inflamed, and so you just know that might be helpful if you get the port in a week before you start your chemo to give it a little time to heal. Also, follow their directions closely for how to care for it after it. When not to get a shower for a certain period of time. All the things that they tell you to do, because you don't want to get this wonderful work your surgeon just did infected after, or hurt it. I mean, my doctor told me not to raise my arm above this level and some other things to try to prevent it from being dislodged or, injured. It was very vulnerable and very precarious. You could feel it. Like if you did the wrong thing, it might, I don't know if it would come out, but it kind of felt that vulnerable. So, just pay attention to the details because you sure don't want it. You don't want the port to dislodge itself or flip. One of the examples that they gave me was it could flip if you did the wrong thing with your arms and did stuff. And then you, of course, don't want it infected or anything. So any of those things would delay your treatment, and you don't want that. So anyway, those are some tips on ports. They're very wonderful. They make it much easier to do all the things that the chemo doctors need to do. And they can stay in you for a long, long time. They do need to be flushed with saline and heparin at a certain frequency, but that's about the only maintenance. In other words, as long as you're not getting it dislodged or getting it infected, then the flushing are really the only maintenance items that need to be considered to taking care of it, no matter how long you have it. So last but not least, I do wear this bracelet. It was given to me. It says the name of my port, and I was asked to wear it on the side that my port was on, so that if for some reason I was incapacitated or whatever, they needed to do some work on me, they would know that I had a port and that it was on the side of my body. All right, guys, take care.